The full committee, the gentleman from Georgia, Mr. Collins, for his opening statement.
Thank you, Chairman Cicilline and Ranking Member Sensenbrenner, for holding this hearing. I'd also like to thank both of you for the works on the CREATES Act, and I believe this legislation is a good starting point, and I look forward to continuing to work with both of you to ultimately get this bill signed into law this term. Over the past decade, consolidation across healthcare and prescription drug markets have been rapidly increasing. Nowhere is this more prevalent than in the pharmacy benefit manager marketplace. PBMs, in theory, should bring down the cost for consumers. However, they're not doing that. There are only 3 major PBM companies, and they control 85% of the marketplace, which yields each company a great deal of power. And these companies have consolidated horizontally as well as vertically as they go forward, and they have merged vertically with major pharmacies and health insurers. That means patients' insurers has financial incentives to push the patients toward their pharmacies. This consolidation has enabled PBMs to engage in anti-competitive behavior by targeting competing pharmacies with unfair audits and under-reimbursement. These audits provide PBMs with the pharmacy's acquisition cost and patient data. PBMs then use this data to steer patients to their own pharmacies and reimburse competitive pharmacies at a much lower rate. This results in PBMs lining their own wallets. It harms community pharmacists who have to decide between losing money and filling a prescription or losing customers to big box pharmacies owned by PBMs. If you look at Ohio, CVS and Optum Rx charged that state more than $400 million more than they paid out to pharmacies. It is just amazing to me that we will continue to turn an eye and not have the discussion. If we wanted to lower drug costs in this country right now, start with the PBMs. Start right where they're at. I've been talking about this for 6 years. I just laid it out. They're going full throttle trying to kill independent pharmacists and pharmacies in our communities. They offer little more than anecdotal evidences of saving money. In fact, when others have actually, states such as Texas and companies such as Caterpillar and others have actually went away from their PBM system, they saved money. PBMs, it's just amazing, have immense control over patient formularies, allowing them to push patients to high-cost medications because these medications give the PBM higher rebates. As a result, PBMs increase patient copays and incentivize manufacturers to increase drug costs to pay PBMs higher rebate demands, so PBMs are actually costing patients money. PBM's role as intermediaries also allows them to extract rebates and price concessions for competing pharmacies and manufacturers without passing them on to the patients. You know what's really interesting about this? I've been talking about this 6 years. I've never had a PBM come in and deny what I say. Never. They just don't like the way I talk about them. They don't care that their practices are bad. They just don't like that I call them for it. It's amazing. This lack of transparency in the price concessions are often withheld from patients and payers and increasing PBM profits while failing to decrease drug costs. I recently introduced a legislation called the Fair Pricing Act with Representative Gonzalez from Texas, a Democrat from Texas, and also Senator John Kennedy from Louisiana. This legislation will require PBMs to pass pharmacy rebates and price concessions on to patients at the point of sale. That will save patients an estimated $9.2 billion over the next 10 years. Key provisions from my legislation are also included in the proposed rule from the Department of Health and Human Services Secretary Alex Azar. Additionally, states across the country, including my home state of Georgia, have realized this lack of transparency in the marketplace, and legislators are passing laws requiring transparency for PBMs regarding the rebates, price concessions they are receiving from pharmacies and manufacturers. These laws aim to ensure that patients are receiving and seeing the savings PBMs claim to be offering and negotiated on their behalf. I do want to talk, Mr. Chairman, about another issue that is dear, especially in Georgia, and that's hospital consolidation that the full committee chairman also talked about in rural communities. These communities often already have few options for quality care, so a hospital consolidation is increased over the past 10 years. Rural communities like my own have been hurt the most. At times, these mergers and acquisitions can help rural communities by keeping facilities open, but they result in full or partial closures and shifting patients from nearby facilities to those hours away. This doesn't benefit patients. Instead, it hurts them because they're unable to receive the life-saving treatment they need. In some areas of my state, we have seen mergers limit emergency care, increase patient travel time by hours. Imagine if a woman was in difficult labor but had to travel hours to a healthcare facility. These changes can literally mean the difference in life and death. I've also seen hospitals acquire other pharmacy and physician practices in the area to steer patients away from their competitors. I'm concerned that these practices will result in fewer options for patients, higher costs, and a lower quality of care. I want to commend this subcommittee for reviewing the consolidation and anti-competitive practice across the healthcare marketplace. And I'm looking forward to working with the chairman and others on this across the aisle to find real solutions, because we must decrease the cost of our healthcare and prescription drugs while increasing patients' access to the best care possible. And that means taking a look at everything on the table. And it is time the pharmacy benefit managers realize your time of terrorizing this marketplace is over.